Welcome to the GynaeGuide, where we tackle major topics in obstetrics and gynecology. In this video, we will talk about endometriosis, the signs and symptoms, how it is diagnosed, and the management. Endometriosis is caused by small deposits of womb lining, similar to endometrial tissue, in areas where they aren't normally expected. This is usually nearby areas such as the ovaries, the fallopian tubes, or the tissue around the uterus. It can also affect further away areas, like the bowel, urinary tract, the rest of the abdomen, and even the chest. Normal womb lining is sensitive to the levels of sex hormones that come from the ovaries, like estrogen and progesterone, that circulate throughout the body. These changing hormone levels cause the womb lining to grow and break down each month, in a cycle we call the menstrual cycle. In endometriosis, these deposits of endometrial-like tissue may undergo similar changes during the menstrual cycle, causing bleeding and inflammation in these areas. This causes problems like pelvic pain, cysts, or scarring on the ovaries and reduced fertility. Endometriosis is very common, affecting roughly 1 in 10 of those assigned female at birth during their reproductive years, around 1.5 million in the UK. It causes very variable symptoms, including symptoms that can occur in the absence of endometriosis, so diagnosis is difficult. As a result, many suffer for years before it is diagnosed. Endometriosis can present in different ways with various symptoms and combinations of symptoms. This includes painful periods, pain in lower abdomen, which may worsen at different stages in your menstrual cycle and affect your ability to carry on with your day, pain during or after sexual intercourse, pain or discomfort during urine and bowel motions, and fatigue, with some people feeling that they have no energy and feel tired all the time, potentially impacting your ability to work. Some complications of endometriosis include adhesions. This is when scar tissue develops, which can occur due to inflammation, causing chronic pain in the lower abdomen. Difficulty conceiving due to adhesions that can affect the normal relationship and environment of the tubes and ovaries. Chronic pelvic pain, and mood changes including depression. There are also some complications associated with treatment. Medical and surgical treatments used can cause side effects and potential complications. If you are concerned about endometriosis, the next step is to speak to your GP. Diagnosis can be difficult, but there are 4 stages that are generally used. 1. A clinic appointment where the doctor will discuss your symptoms and examine you. 2. Imaging of the pelvis using a scan. 3. A keyhole surgery to directly look at the pelvis. And 4. Analysis of a biopsy, small piece of tissue, which is taken during the surgery. Although a formal diagnosis is made after surgery, endometriosis may be suspected at any stage. At the clinic, the doctor will ask you some questions about your symptoms and how they have been affecting you. It may help to keep a symptom diary before seeing the doctor. They will also ask questions about hormone treatment, other treatments you are taking, any existing medical conditions, and your general health. Following this, they will often examine you. You will be given privacy to undress from the waist down, and the doctor will perform 2 examinations. They will insert a finger while pressing on your abdomen to feel for any changes such as pain, reduced movement, or small vaginal lumps that are associated with endometriosis. They may use something called a speculum to gently open the vagina to look for any small lumps around the cervix and vagina, again, possibly associated with endometriosis. A chaperone will be available to be in the room while you are being examined. The GP can do the initial assessment and refer on for imaging or for a specialist opinion at the hospital. Ultrasound scans are a common first-line imaging method, but an MRI scan may be needed if bowel symptoms are present or deeper organ involvement is suspected. Ultrasound involves using sound waves to visualize the inside of the body and is usually finished in under 30 minutes. Often, a transvaginal ultrasound is required, where the ultrasound probe is inserted into the vagina in order to be closer to the uterus for better quality images. Sometimes, this isn't necessary, and sufficient images can be taken from a probe moved across your abdomen. What type of ultrasound, how to prepare, and what you can expect should be provided in a leaflet when your appointment is made. In an MRI scan, you will lie flat on a bed and will be moved inside of a large, donut-shaped machine which can capture a more detailed image of the inside of your body. It can be quite noisy, but it is usually finished in under 60 minutes. Staff will be present throughout, and you will be able to alert them if you experience any discomfort. A definite diagnosis usually requires surgery that is performed by the hospital specialist. As well as making the diagnosis, surgical treatment may be offered. This is a keyhole procedure, meaning it is performed through very small cuts in your abdomen, where the surgeon will look for any signs of endometriosis. They may take samples of any suspected areas of disease or try to remove any endometriosis seen. The location and extent of your condition will be documented and staged. The full details of this procedure, including risks and benefits, will be discussed with your surgeon prior to the operation. It may be helpful to prepare a list of questions in advance. One important risk to be aware of is that the surgeon may not find any endometriosis at all. Shortly after your surgery, any samples taken will be examined by another specialist, who are able to detect if endometriosis is present in the samples. Usually, you will discuss the results of this with your gynecologist during follow-up from the surgery. Unfortunately, there is no cure available at the moment, and treatment is mainly focused around pain management and the problems you are experiencing at the time. One thing that is important is painkillers. Often, over-the-counter medications such as ibuprofen and paracetamol may be used individually or combined to manage pain flares. Stronger painkillers or drugs that reduce inflammation can also be prescribed. As endometriosis is sensitive to hormones, hormonal therapy can be used. We know that the endometrium grows less while on the pill, and the combined pill can help, and running packets together can reduce the frequency of periods. We know that drugs that are like progesterone can help keep endometriosis growth under control. Additionally, progesterone tablets, implants, injections, or coils can all help. Another option is to switch off all hormones to give a temporary menopause to allow the body to try and resorb the endometriosis. This is done using an injection called GnRH analog that is given monthly. However, it is important to remember that hormonal treatments are generally contraceptive and not be possible if currently planning on becoming pregnant. If patients are undergoing keyhole surgery for diagnosis, lesions found can also be removed at the same time. Sometimes the operation needs additional specialist input or skill, so it might not be completed at the first operation. Although an operation doesn't usually have a big impact on fertility, it can improve the pain. Removing the womb and even the ovaries entirely may also be considered, but is normally reserved as a last resort. However, there is still a chance for recurrence of endometriosis lesions and pain symptoms even after surgery. Apart from medications and surgery, patients may consider lifestyle changes, such as dietary modifications, regular exercise, and good sleep habits. Sometimes, input from a counselor or psychologist can help develop strategies to cope better with the pain and discomfort. In summary, endometriosis management should be patient-centered, and decision-making should revolve around the patient's ideas, main symptoms, and fertility goals. In this video, we covered what endometriosis is, the signs and symptoms of endometriosis, how we diagnose it, and treatment options. If you have any questions about any of this, we'd recommend that you ask your clinician. We would like to thank Endo South of Scotland for their support in the development of our learning materials. Endo S.O.S is a voluntary support service for people with suspected or diagnosed endometriosis and can be found on Facebook. We hope you enjoyed learning with us. Be sure to follow us at the GynaeGuide, and we'll catch you next time. This work was delivered as part of a teaching project by fifth-year medical students at the University of Edinburgh.